Hi guys, welcome back to my channel. It's your Farm D with the T. I wanted to comment on some information that I came across in the news. Right here is an article that was published in CNN Money. Amazon founder Jeff Bezos, as well as Warren Buffett's Berkshire Hathaway Company, and JPMorgan Chase, one of the largest banks in the United States, if not the largest, the CEO of that company, the three of them are teaming up to basically come up with another company that will give their U.S. workers and families better options on health insurance. Right now, they're just going to be focusing on their own U.S. based workers, but there's been some whispers, and when you get more into what it is that they're discussing, their plans that they have, you can see how this can serve as a prototype and a pilot for other US based workers to benefit from these changes from a company that these three are trying to collab together and create. Now, this isn't something that the three of these guys have that just popped into their head one day recently and they're like, oh, yeah, we're going to do it. It didn't work that way. These three are friends. They've periodically have spoken about this, formally and informally over the past couple of years, talking about basically the status of healthcare in our country, especially the rising cost of healthcare. These are businessmen, and healthcare expenses is a very high cost to employers, not only employees, but employers within the United States. So I'm not surprised that these businessmen, these top businessmen, have conversed over the topic within the past few years. But why are they doing this? Why have they decided basically enough is enough? We need to figure something out because what's going on isn't working. There is no secret that our nation spends trillions, trillions of US dollars on healthcare. And it is also no secret that the cost of healthcare keeps climbing. And despite the fact that the cost of healthcare keeps climbing, when it comes to the health status of the US population, that isn't getting any better. That equation isn't balanced. It doesn't make sense. Other countries in Asia, countries in Europe, have a higher quality of life, health status, have a longer life expectancy than the US population, but yet they spend less on healthcare as an overall portion of their nation's GDP. Why is that? Speaking of our nation's GDP, I went to the Centers for Medicare and Medicaid Services to get some numbers for you guys. So, U.S. healthcare spending grew 4.3% in 2016, reaching 3.3 trillion or $10,348 per person. As a share of the nation's gross domestic product, also known as the GDP, gross domestic product, health spending accounted for 17.9%. Do you guys understand how significant that is? And that was back in 2016. Basically, for every US dollar spent, 17.9 cents was on healthcare. And to be honest with you, I think that might be lowballing it in terms of estimates. I think that's a very conservative estimate. Now, in another article published by CNN Money, Buffett said, "We share the belief that putting our collective resources behind the country's best talent can, in time, check the rise in health costs while concurrently enhancing patient satisfaction and outcome." I agree. Ultimately, that is the goal. I think it's very doable. I think it's very possible. We need their expertise. So I'm really excited to see where this can lead us as a nation. This article states national health spending, which includes spending by federal and state governments, the private sector, and individuals, have risen from just 5% as a share of the economy in the 1960s to 17.9% in 2016, according to the most recent data from the Centers for Medicare and Medicaid Services. So this is the scary part right here. It's projected, meaning the share of GDP spent on healthcare costs by our nation, is projected to rise to 19.9% by 2025. So nearly 20% of the money in our pockets, 20% of taxpayer dollars, 20 cents on the dollar will be spent on healthcare at the rate that we're going if there isn't a change. We went from 5%, which is not even 60 years ago, almost. We went from 5% to almost 20%. That's not even a lifetime. So I can see how people feel like they have less money in their pocket right now than they did back in the day. CMS estimates spending will grow 5.4% in 2017, due primarily to faster growth in Medicare and private health insurance spending. You guys, our population is aging. Our older members of our population are living longer, which is great. Or let's say certain parts of that population are living longer. It's not exactly spread across the entire elderly population. That's definitely not the case. There's definitely disparities. They're also utilizing more health care in the process, and their primary source is through Medicare. Medicare is a very large percentage of that growth in healthcare expenditures, as well as private health insurance. Private health insurance is the insurance that you get from your employer. It's the insurance that you seek out on your own from a private company. There's a difference between private and public. Public is Medicare, Medicaid. Private is basically everything else. And also keep in mind, there are people who we call dual eligibles who qualify for both Medicare and Medicaid. Whoa. Private sector employers paid nearly $665 billion in 2016 in health-related costs, up 5% from the prior year. The average premium has risen 19% over the past 5 years to $7,000 for single coverage in 2017, so basically the coverage of one person, yourself, and to nearly $19,000 for family coverage. according to the Kaiser Family Foundation. Employers pay about 3/4 of their workers' premiums. So, U.S. workers, us, despite the rise in healthcare costs, despite the fact that we can feel it, do you realize we're still insulated from the majority of the burden? Our employers cover a lot. That benefit package that includes your healthcare is a lot. It is a large cost to your employer. So when you see things going on in news and politics concerning healthcare reform, I want you to keep that in mind, because that will probably explain why certain lobbyists, why certain politicians, why certain companies are for one thing and not the other, because at the end of the day, it's about the bottom line. It's about costs. It's about money. This is a huge cost to employers. Between 2005 and 2015, okay, the time span of 10 years, average out-of-pocket costs grew 66%, or more than twice the growth rate in wages during that period, according to Kaiser. So that's another thing that is like detrimental. It's one thing if our wages are going up at that same rate, but our wages are not. We're paying more for the same amount of service, and we have less money in our pockets once everything is paid, because our wages, the rate of wage increase, does not match or exceed the rate of these expenditures. So in the first article, they mention experts say that given the resources of the companies, we're talking about JPMorgan Chase, Amazon, and Berkshire Hathaway, and their history of concentrating on the long term rather than just the near term, they have a chance to make significant changes in the way healthcare is provided. Regardless, it won't be an easy industry to change. And that's very true. Change is very, very slow when it comes to healthcare. Usually, at least when it comes to our system, the saying goes, 80% of the cost comes from 20% of the population. You never know. Something may happen to you. You could be the healthiest person and something happens. Your body falls apart and you become ill and you need that health care. And you're not necessarily thinking about how much it costs or the burden it places on society. You just know that you need help. And that's what it's there for. But we need a system in place that allows that to happen without causing all these other issues for everyone else. In 2000, the average annual premium was less than $2,500 for single coverage and $6,400 for family plans. That's a huge difference from what the other CNN Money article stated was the estimated premium that U.S. workers are paying now. I'm thinking that maybe one of the reasons why the percentage of the cost that employees pay are going up is so that we become more aware of how much stuff actually do cost. We became desensitized. We are desensitized, and that now that we're being exposed to more of the cost, we're waking up and we're realizing just how expensive things are. And even then, the kicker is we still don't realize how expensive things are because we're only experiencing a small portion of it. Now, with all that said, I do want to bring up the point that this idea that these three businessmen have, it's not something new. As a matter of fact, China has already been doing this. We are lagging behind, you guys. China has already started this. They've already done this, and they're planning on expanding this. Oh, by the way, this is an article in the New York Times. Technology companies like Alibaba and Tencent have made healthcare a priority for years and are using China as their laboratory. After testing online medical advice and drug trafficking systems, they are now focused on a more advanced tool, artificial intelligence. They want to leverage artificial intelligence in healthcare. That is very forward thinking. That is huge. Chinese hospitals are overburdened with just 1.5 doctors for every 1,000 people. That's insane. Barely half the figure in the United States. Along with a rapidly aging population, China also has the largest number of obese children in the world, as well as more diabetes patients than anywhere else. The company's technology push is encouraged by their government. Beijing has said it wants to be a leader in AI by 2030. So here's a country, China, who is actively promoting these advances in healthcare, knowing that their healthcare system is in dire need. These companies are being backed by their government. It's fair to say that across the board, the Chinese tech companies have all embraced being involved and being active in the healthcare space, unlike the US, where some of them have and some have not. Ooh, the shade. Now, keep in mind, not all of the moves that they've made in China have been successful, but some of them have been. For instance, last year, Alibaba's health unit introduced AI software that can help interpret CT scans and an AI medical lab to help doctors make diagnoses. Tencent unveiled MyYing, a medical imaging program that helps doctors detect early signs of cancer. It is now used in nearly 100 hospitals across China. That's amazing. So, with all that said and done, I would really like to hear you guys' thoughts. This was basically just my commentary on the information I was able to come across involving the plans of these three gentlemen as well as what's been done outside of the US. But, comment down below. Let me know whether or not you think that these three men, what they're trying to do is a great idea for our nation, that you can see where it can lead us, how it could help us. Let me know if you have any concerns about this idea. Let me know your thoughts on the fact that another nation, China, has already began doing this, and we're kind of lagging behind. What do you think? How do you feel about that? Again, thank you guys for stopping by my channel. Share, like, and subscribe. And I will see you at my next upload.